Hello again. So today we're going to be doing a short workshop on percussion therapy for your own upper cervical spine using the 3dEnergy gun. So hopefully you've watched the previous videos that explained some of the science and the theory behind using this therapy to get powerful therapeutic effects into your cervical spine. You can find out more at the website, and feel free to ask questions anytime. So just to do a quick anatomy review of your upper cervical spine, there are so many structures all meeting and combining and crossing over each other in this area. So we have superficial muscles. We've got your trapezius, got your splenius capitis, got your semispinalis capitis, got your levator scapulae. All of these coming up to attach along onto the base of the skull and into the upper cervical spine. Then underneath those layers, we have even more layers. So rectus capitis posterior minor, rectus capitis posterior major. If you watch one of my previous videos, you'll see the vital importance of these specific muscles in the upper cervical spine, because they don't just have vertebral attachments, they've also got meningeal attachments. So your obliquus capitis superior, obliquus capitis inferior, longissimus capitis, semispinalis capitis, splenius capitis, all of these muscles all merging into the upper cervical spine. And as I said, there's these critical small muscles in the upper cervical spine. We have the occiput. It's probably overrepresented in terms of its relative size here. Have your lambdoid suture. Have all of your occiput, superior nuchal line, inferior nuchal line. Then we've got these intrinsic muscles attaching into the C1 and the C2. And then, of course, underneath all of that is the spinal column. And even more inside that is the spinal cord. So your occiput, your atlas or your C1 and your axis vertebrae are all regarded as the critical upper cervical spine. And don't forget, we've also got fascia, complex, intricate fascia that wraps in between and around all of these muscle bundles and all of these tissues. So they also can play an important part in the function of this upper cervical region. So just quick review of where some of these muscles attach. So your obliquus capitis superior, transverse process of C1 to the inferior nuchal line. Obliquus capitis inferior, spinous process of C2 to the transverse process of C1. Rectus capitis posterior major, your inferior nuchal line of your occiput to the spinous process of your axis or your C2. Rectus capitis posterior minor, the inferior nuchal line to the posterior arch of atlas. Very intricate structures. Longissimus capitis comes up from the transverse processes of T1 to T5 to your mastoid process, which is actually a temple bone. Then upper trapezius comes up from the scapula all the way up to the superior nuchal line. Levator scapula comes up from the spinous up to the spinous processes of C1 to C4. Semispinalis capitis, transverse processes to the superior nuchal line. Splenius capitis, spinous processes to mastoid and the superior nuchal line. And there's SCN, the sternocleidomastoid, the mastoid process, and the superior nuchal line laterally. In splenius cervicis, the spinous processes of T3 to C6 to the transverse processes of C1 to C3. If you've listened to some of the conversations in my other videos about tensegrity, then you'll see how these muscles really model tensegrity design. So here's some directions for how we're going to be using our 3dEnergy gun in this upper cervical area. So on the left side of the spine, we're going to be using clockwise rotation. We want to be lengthening the left side of the spine. On the right side, we'll use counterclockwise rotation to lengthen that side of the spine. So select your preferred impulse, RPMs with your gun. So set how much force you're wanting to use. Obviously, if you're new to the 3dEnergy gun, begin in the first gear in the lowest RPMs. As you get used to it, you'll find you have a preferred level. I really like third or fourth gear on my own spine. So remember, you're not creating the pressure, you're not creating the force. So just holding the tip gently against the spine, allowing the gun to deliver the force. Now, what we're going to be learning how to do is using a scanning motion, and you'll get quite proficient with this in use of the 3dEnergy gun, where you can literally almost allow the gun to walk across the spine, and you just have to direct it and guide it in its motion. So we're going to be starting at the top, starting in the midline at the external occipital protuberance. We're going to be working from medial to laterally down the lambdoid suture, and then we'll gradually scan lateral to medial, medial to lateral, gradually working inferiorly till we've covered the upper cervical spine. So as I said, we'll start here at the EOP, and we'll just slowly allow the gun to slide and glide across the occiput, working our way backwards and forwards, covering the superior nuchal line, all of those attachments that we looked at before, coming down all the way to our inferior nuchal line and those critical intrinsic muscles. And then we're going to just slowly work our way across the C1 down to the C2, working laterally to medially. And so, as we said, scan across the lambdoid suture. Don't forget that the sutures have lots of adjacent meningeal attachments, so they're critical for stimulating the internal structures. Covering the superior nuchal line, covering the inferior nuchal line, checking for pinpoint tenderness, going to your occiput C1 interspace, posterior arch of C1 from medial to lateral, your C1, C2 interspace, and your lamina of your TP to your TP of your C2. And then you can get down. C2, C3 is usually where I finish my upper cervical therapy. So here's what we're doing. We're searching. We're just scanning for points of tenderness. And when you're doing it on yourself, you can pinpoint these down to tiny little pinpoints of tenderness. So those areas just sustain the impulses on these isolated points. And what you'll usually find is you literally feel the tenderness of this tiny point dissipating, even vanishing as you're stimulating the point. So try this. It's a fantastic way to really notice the difference of the torque and of the specifications we built into the 3dEnergy gun. Gives you additional benefits that you can't get from just a normal percussion massage gun. We've changed the way the tip works. We've changed the internal engineering. We've added the rotation head so that you can get extra therapeutic benefits. So later I'll be posting another video just doing a demonstration of this process so you can see it in real life. Thanks for listening.